All right, Garen. So, I've got a confession lead segue for you. I had a discussion with my father-in-law on the weekend as to what's a good blood
Okay.
pressure rating to have, and luckily this week you're going to tell me about
You
blood
have
pressure.
many discussions with
Not
your
many. He was just telling me
father-in-law.
what his blood pressure is.
I think a better, I think a better segment is just talking about you, and a better segment would be a recording of Indy's blood pressure while driving while his father-in-law's in the car. Now
I don't think that my blood pressure will
that
fluster
would
too
be,
much. I
you know,
don't think I would. I don't get flustered. I just get annoyed.
oh, bro, I think, yeah. What do you think that does for blood
But I
pressure? Goes up.
don't. Shit. All right. You're correct.
No,
You're
no,
correct.
we need some data on this baby. Right, Sanjay's gonna hook you up. Right, we're gonna do this. Secret blood pressure monitoring. You got to make sure your father-in-law doesn't know, right? So like under your jacket or something, and just record your vitals, like your blood pressure, your heart rate, your pupil size. Oh, this
Thanks,
would be
man.
excellent, man.
Anyway, blood pressure ratings. What's a
So
good blood pressure? Gone.
that's the first. That's the first. I will come to that. That's the first important thing. Blood pressure can be affected by many things: being scared, being unwell, being stressed. These things can make your blood pressure fluctuate. So think of blood pressure more like a yo-yo. It goes up and down. At no one time will your blood pressure be the same. So no one reading is important. That's the first thing. A lot of people come in hospital on the back of one high reading. Means nothing. So before, the way GPs used to diagnose high blood pressure was used to take 3 random readings. That's all we used to do. Now we fit a box on you that takes blood pressure for 24 hours. Takes about 600-700 recordings every like 15 to 30 minutes, and then
Right.
it takes an average. And what that's trying to do is, so you have your normal working day, you have your periods where you're at work, not at work, with friends, sleeping. So it's trying to get a good, picture and idea of all facets of your life. Is it just some points in the day where your blood pressure is high, but your average is still then okay, or is it consistently and constantly high? So that's the first thing. So now here's the thing about blood pressure. So unless your blood pressure is super high, I'm talking like your top numbers like more than 180, 190, 200, then you may not have any symptoms. So kind of that mid-range of high blood pressure. So again, top number wise, let's say 150, 160, bottom number, anything more than 90. 90 is kind of the magic number for GPs. Anything more than 90 at the bottom is kind of considered potential high blood pressure or hypertension, as we call it. And at that level, you're not going to have any symptoms, right? Only at the very, very high levels can you have headaches, loss of vision, nausea, vomiting, difficulty walking. Very, very high, obviously, blood pressure, super high blood pressure that's been there for a while can lead to a stroke, heart attack, kidney failure, blindness. So, but those are very extreme things. But this kind of mid-range thing, initially, you won't have any symptoms. And the problem with that is that when you tell people they have high blood pressure, they're like, really? I don't feel unwell. Then you give them a tablet. The tablet doesn't make them feel any better because they didn't feel
Doesn't the
unwell at the
tablet
start
come with side
anyway.
effects as well?
So they don't see the
Probably
point of
makes it feel
it. So
worse.
they're not compliant with their medication. Yeah, that's true. So you can have side effects. So one of the most common blood pressure tablets is something called amlodipine, which is a calcium channel blocker. Will give you swelling. Well, can give you swelling of your feet. Or ramipril, which is an ACE inhibitor, can give you a dry cough. So yeah, you're right. So you can either have no effect or have a side effect. You're like, well, I had nothing to begin with, apart from this number, which I don't know if is high or not high, and now I'm on this tablet. Now, what I say to people, because often some of this work I do is screening-based medical work, and if I find someone with suspected high blood pressure, I'm like, look, the best thing you can do, because it's going to be hard to see your GP just for blood pressure, like it's just not, no, it's not that it's not sexy enough. It's like GP appointments are so rare. So like the complexity, what's needed in GP appointments is so high now that this kind of blood pressure checking is kind of been outsourced now to pharmacies and kind of other settings like that. I literally say, look, hey, give me a phone, give me Amazon. I'm going to find you a blood pressure machine. It's like £5. Take your own blood pressure, get your own readings. If you come to any medical setting, say before an operation or for a job which requires you have a medical assessment, you've got your own readings. I'm going to use those readings. They're much more accurate. You've taken them in your own kind of place of comfort. You're not stressed. You're not worried.
Got no reason to give me a scheme.
Because one thing that can happen is something called white. Yes, and we call that effect white coat hypertension. Coined because in the past doctors used to wear white coats. Patients would see the white coat, they get scared, blood pressure goes high. So it's not really high, but looks high. So to give you an example, my dadi, my grandmother, her blood pressure is I think 120/64. So she has like better than textbook blood pressure. 83 years old, super fit. Her secret is basically she walks like 3 miles every day, and she lived in an age kind of before McDonald's and that kind of stuff. So she just eats what she makes. Now, if I take her to your hospital for an appointment, she has blood pressure there, more than 200. The same lady just does not like it. And I always tell her, I was like, look, it's going to be high. So one reading in itself, not a problem. What we have to be mindful of in a developed country like we are in England, America, Canada, places like that, is chronic disease. So things like high blood pressure and diabetes are the real killers for us. So in the past, we died from things like pneumonias and heart attacks and things like that, but our management of these acute conditions, these emergency conditions, has got a lot better. You have a heart attack, you might have a stent put in, you don't die, you carry on. But these things like blood pressure and diabetes, they are the things that need to be controlled. It's like I said, you're not going to feel any benefit, but what you're doing is by being on this medication and controlling that blood pressure, you're offsetting the risk of, kidney failure, blindness, risk of stroke. So all these things are super, super important. And blood pressure is, the cornerstone of that. I think in the UK, once you get to the age of 50, you start having these Wellman checks, which is kind of like once a year, see your GP, have a blood pressure, height, weight, have some blood tests done. We screen you for diabetes. We screen you for cholesterol. So what we call the cardiovascular risk factors. We live in a society now where we're not really hunter-gatherers anymore. We're much more sedentary. I'm happy that my job involves me walking around and having to see things. I imagine you do that a little bit as well, or was it just all computer-based?
But I make a point of going for a walk minimum every day, and I have to exercise at least 3 times a week. Otherwise, I don't feel good.
Good lad.
So yeah.
Good. So you're making a conscious effort. I think that's the point, isn't it? I think whereas our ancestors they had it built into their day, and I know, like, for example, on Saturday we went to Cannock Chase and we did a lot of walking, and then we went out for dinner afterwards. And it felt like we'd earned our dinner. We'd done a lot of walking around. We don't have that unless you build it in, and because of that sedentary, these chronic diseases creep in. And you think about it, so it's all to do that we eat too much, so we have way too much convenience, and we don't exercise. Diabetes is the product of that. So, yeah, it's really simple. I had a lady come in today actually with high. She woke up in the morning, she felt a bit hot, took her blood pressure was high, carried on, kept taking her blood pressure all day, but worrying and thinking about it, kept getting higher and higher and higher. She's on a blood pressure tablet. Rang 111, 111 said, please get to A&E. She came to A&E, I saw her. I was like, don't worry, it's fine. Blood pressure should come down. We had a good chat. I said, right, for next week, please take your blood pressure readings. If it's high, see your GP, and I've given a recommendation for how we can tweak your blood pressure tablet. So this stuff really does happen. People do present to hospital. Sometimes we diagnose it for the first time. The thing, I guess, to be mindful of is if you're a young person and you genuinely have high blood pressure, so if you would have high blood pressure, then as opposed to somebody's elderly, when we say they have essential high blood pressure, essential hypertension, which is age-related expected high blood pressure. In someone like you of your age, that would be concerning. Why have you got high blood pressure? What is the underlying cause? There has to be something driving that blood pressure. So then you would be subject to a larger battery of tests to try and work it out. Whereas an elderly person would be like, well, let's just commence them on treatment. It's probably age-related. So that's important when it comes to blood pressure. And the only other important group of people is pregnant people. So we talked about pregnant ladies last week and blood clots. There's a condition. Have you seen Downton Abbey? No. Okay. So one of the characters in Downton Abbey is pregnant and has a complication of pregnancy called eclampsia. There's 2 conditions, preeclampsia and eclampsia. One of the things that happens in that condition is you start passing lots of protein in your urine, and your blood pressure goes super high. And the combinations of 2 things can lead to eclampsia, which is a very, very dangerous condition, which can lead to seizures in the mother and death. That's what happens in the show as well. So high blood pressure in the context of pregnancy can also be very concerning as well. So not something to be ignored. If you've got a machine, and we can talk about your father-in-law in a second, it's just worth doing it every once in a while. So, for example, I do blood pressures on everyone in my family twice a year. So I have like a kind of medical check-in thing I do like twice a year. So I have a chat with them. Are you concerned about anything? Let me take your blood pressure. Make sure you get your eyes checked. And then for mum and dad and like daddy and granny and people like that, I review their blood tests. Make sure you get your blood tests done. They end up going to India for holidays and end up getting blood tests done there as well. And I'll review those. So it's just keeping on top of them. But even at our age, now and again, just doing a blood pressure, not a bad thing.
I guess so. I mean, what's the actual number that you should be looking for then? Like, let's just give like a quick summary. So I'll let you finish your drink. Okay, so quick summary.
Textbook is 120 over 80.
Okay, so quick summary is gone.
You got to ask me the question.
Well, what's a normal number that should be on the top?
So 120 is textbook top, but that will increase with age. 80, anything above 90 we consider to be high blood pressure.
And how often should you be doing this if you're, I don't know, in your 30s to 50s? 30 to 50, in between 30 and 50.
30s, 50s, twice a year, unless you get a high reading.
Okay. And going on blood pressure medicine.
The closer you get to 50, you might go to frequent.
Okay. Going on blood pressure medicine, is that better or worse for you?
Yeah. It depends what you mean by better or worse. And obviously, if it fixes your blood pressure, it's a good thing. From a medical perspective, if you're delaying the onset of certain serious complications.
So, are there side effects associated that make
everything has side effects
worse taking
but you're trying to... No. I think, look, any tablet can give you any side effect. The problem is not every side effect happens in every person. So it's a bit of trial and error until you get to a tablet that you can tolerate. So that's the important thing. It's where is your tolerance, and then you're trying to be on the smallest dose that gives you the effective output. You don't want to be on the highest dose of everything, just because you know it's going to give you the result. But often that can be more harmful. So, for example, you take too much blood pressure medication, you're going to have a low blood pressure, you're going to get dizzy, you're going to pass out. So that does happen sometimes with people. They're over medicated. So, for example, like we have this often. People come into hospital, and we take the observations. Oh, bloody hell, blood pressure is really high. And we look at their drug history. Right, there are 4 tablets for blood pressure. And then what happens is, because they're in hospital, we give them the medications. What's happening at home is they're not taking them. So in hospital, they take them all, and the blood pressure goes really low. So it's not really high. It's just because they're not taking it. We had a guy come in today with low blood sugars. And then the junior doctor came to us and said, so why is blood sugar low? And he goes, oh, he takes his insulin, but he just never checks his blood sugar. And I was like, that's great, isn't it? I was like, so his body's having the appropriate response. He's not adjusting his insulin units. He's just taking it. He's like, yeah, insulin. He's not checking his blood sugar, and he comes in when it's like super low because something happens. And I was like, oh, check sugar, man.
He just needs to get that scanning thing that Sanchez has. What's it called? The Freestyle Libre.
Welcome to the NHS. And the scanning thing. Yeah. Funding, baby, funding.
Get it on your prescription, man.
Not everyone's from London, everyone's posh like you guys. You guys are too posh. You got access to all these things that people, commoners, don't have in West Midlands. That's what it is. Yeah, mate. That's right. Upgraded yourself, didn't you?
I didn't upgrade
Moved to
myself
London. Yeah,
it's on prescription.
Got all the access to all the premium stuff. Oh, yes, you did.
One day, one of us
you
might
moved
need
to
to
London with
so
a prescription.
we know the technology is better than what it used to be when it comes to checking your blood sugar.
Absolutely.
It'll be you first, me second. Thank you.
Well, yeah, absolutely. Because you play so much pro basketball, you're obviously immune to
do pro everything.
the effects
Cricket,
of diabetes,
football,
aren't you?
Tennis.
Of course.
Everything. Mastery, Indy. Mastery.
No football. I've never mentioned
But
football.
You wish you could. To hand that right, wanna be Dr. J.
It is bad. I've just signed up to 2 new sports. Oh, you call me Dr. J. I'm taking up fencing and archery. Yeah.
Because the current ones you do ain't enough, innit?
There we go. It's not that they're not enough. I think you get to a point where you're like, I'm not going to get any better, and that's fine. Like, I'm at a good level of badminton. I enjoy it. I don't get to play it all the time, but it's like you'll know this because you talk about it in the gym, like the initial bit. You get the growth, and then you get the diminishing returns, the incremental, the
plateau.
very small incremental growth. When you kind of reach that and things, you're like, well, actually, what I enjoy is this. You plateau, yeah. So you enjoy the initial thing. So I'd rather do more things where I can have that. I had something great Indy yesterday. I'll tell the listeners as well. The secret of living is growing and giving. I was like, wow, it's blew me away, man. It might be the fact that it rhymes a little bit, but the secret of living is growing and giving. I give my time to you, and in turn, I grow.
This is not a self-help podcast, man. I feel like you're turning it into that.
This
Two quotes
absolutely,
in one flipping podcast.
absolutely.
Much,
People
man.
want to
Stop
feel good. I know. I'm just feeling it today. That reminds me. Tell the listeners, and please give a shout out to the lady that reached out to you who didn't remember my name, and just specifically for the lady. My name is Dr. Jazz.
His name's Gordon.
Yes,
don't get it
that's
twisted.
a very nice message, and it definitely made my day. It's Dr. J.
The lady's name is Brinder.
You're like, it's not that fan.
So she basically DM'd us saying,
Okay.
how
What
do
did Brenda
you
say?
listen to the podcast online? Because she listens audio at the moment. I said, jump onto YouTube, follow the link tree on our bio, have a look. I said, out of interest, how did you get into this? And she said she stumbled across it. So that was very nice to hear. Thanks for listening, and we genuinely appreciate your support, man. And DMs like that are always welcome. If you ever want to shoot us one and let us know you're still alive and kicking, we see the numbers, we know you're listening, we just don't know who it is. So please tell us, that'd be really great. And we can make some adjustments from there and give you guys shout outs like how we have done here. So yeah, cheers for listening, Brendan. Wave, hello, sassigal. All right,
Thank you.
Last segment, go.